Japan is dealing with rising cases of a disease caused by a rare flesh-eating bacteria that can kill people within 48 hours. Health authorities have reported over 1,000 cases of streptococcal toxic syndrome. How about that as of early June? Higher than the record 941 cases reported for all of 2023. At the current rate of infection, experts fear the number of cases in Japan could reach 2,500 this year. For more on this story, we check out Amesh Adalja, senior scholar at the Center for Health Security at Johns Hopkins Bloomberg School of Public Health. Dr. Adalja, thanks so much for joining us. Can you tell us about streptococcal toxic shock? What is it?
Nice prono, by the way.
I know.
Nice
How
job.
about that? Tell us about it.
So this is Streptococcus is a bacteria that all of us have dealt with. It's the same bacteria that causes strep throat. What can happen, though, in certain individuals is it can be a much more severe infection where it can cause what we call, necrotizing or flesh-eating type of skin infections, and then also spread systemically and cause multiple different organ systems to shut down. So that's when we use the kind of term toxic shock syndrome. It's that bacteria basically disseminates toxins throughout your whole body, and it's a very serious illness with high levels of morbidity and mortality.
Doctor, is this new, or has this always been the case?
It's always been the case. What's new is that in Japan, post-pandemic, they've reported at least 2 years where they've had higher than normal cases. And trying to unravel the mystery of why that change in epidemiology occurred is what's getting headlines right now. But streptococcal toxic shock syndrome has been around forever. It's just this increase in Japan that people are interested in.
How do the medical professionals, how are they treating this?
So the mainstay is going to be antibiotics, but because it's this systemic toxin disease, we often give other drugs to modulate the immune system. And if there are elements of flesh-eating disease going on, they basically have to do extensive surgery to kind of cut ahead of the infection.
Oh my God, this sounds terrible. How quickly does this happen? I mean, strep can come on really quickly, and it might take you a couple days to realize that you have it. Like, what's the cycle for this?
Well, when you get into that toxic shock syndrome spiral, it's very fast. It can be dramatic. Even an hour can be a major difference in a patient.
Oh my gosh.
But it's important to remember that not everybody that gets a strep infection is going to get it. It's still rare. And most people who have a strep infection of their throat or of their skin, it's going to turn out to be kind of a garden variety infection. But it is important for clinicians to keep in mind that if people are getting worse, if they're not getting better, if there are more concerning systemic symptoms occurring, that they think about this. And it's also important for patients to know that as well, that if they're not getting better in the expected time or they're taking a turn for the worse when they're already on antibiotics, that this is something where they need to seek care immediately.
Is there any reason why it would be, localized in Japan here? Anything that is unique to that part of the world?
Not particularly. I mean, we've seen increases in streptococcal infections, not necessarily toxic shock causing ones, all over different countries. For example, the UK had a major issue with this a couple of years ago. And it may be having to do with kind of idiosyncrasies in the immunity in the population in Japan. Remember, we all came through a pandemic where there was a lot of social distancing, and many of the ordinary infections that people get every year were kind of disrupted. Mm-hmm. And there may have been different disruptions in different parts of the world and different prevalences of these infections. And now they're kind of coming back to their prior levels, and there's some catching up to do. There are people who might not have had as much immunity because they weren't exposed at a low level over the last couple of years, or they just might not have been infected. And there's a certain number that are going to be expected every year in Japan. And because you had a 2-year lull, now it's coming back to baseline levels, and that's what they're noticing. So this is kind of one of the leading hypotheses, but we don't know quite everything for sure what's going on in Japan. But that's what I think is at play.
What are the signs? You mentioned that if you're on antibiotics for strep and you don't get better, but you get worse, what are some other signs that people should be looking out for?
Well, so severe, a spreading rash that's getting severe pain if there's a rash where the infection might have been, anything involving low blood pressure, extreme fatigue, not being clear mentally, difficulty breathing, all of those kind of signs that the infection is not localized.
Yikes.
Doctor, I remember we used to talk to you all the time during the pandemic. You were very kind to share your time and, kind of educate a lot of folks on what this virus was, how doctors and health professionals were treating it, and then ultimately the vaccine and the efficacy of the vaccine. So we, again, appreciate all that time you gave us. Now that we've got that in the rearview mirror here, I know one of the themes that came out of that was just the stress on the healthcare system and the people of the healthcare system, the doctors and nurses and everybody that worked. They had to be in the front lines during those early months and that year. How are the folks, the good folks at Johns Hopkins that you deal with in the facilities, how are they doing several years on now?
Well, I think that most healthcare systems around the country have kind of come to a new normal where there's kind of chronic burnout, there are chronic staffing issues, where people quite haven't recovered from the way that the pandemic altered hospital operations. And this is going to be one of the long tails of the pandemic. It's not something that you can just bounce back from. There wasn't a lot of resiliency built into the system. There wasn't a lot of kind of slack in it. And the pandemic ate up all that slack. And I just think that we're in a situation where a lot of people still are carrying those scars around of that time when they were overworked, where there were concerns about personal protective equipment, where hospitals were crashing. And even when you look at the economics of hospitals, we're seeing hospitals close, rural hospitals really looking at their financial viability, hospital bankruptcies. So this was something that took a major toll on the healthcare system, just like we expected and predicted it would. And this is why it's so important to incorporate healthcare preparedness, healthcare resiliency into planning for the next infectious disease emergency, whatever it might be. This can't just be something that we think about when there's a crisis, when it's in the headlines. This is something that needs to be done kind of with a long-term eye to the future, to make a sustainable way to operate hospitals and make emergency preparedness part of their core function.